The history of medicine is full of strange and desperate cures. Consider the terrible night George Washington died. There was bloodletting, then a tincture of molasses, butter, and vinegar, which nearly choked him, then more bloodletting and a mixture of vinegar and sage tea for gargling. They irritated his throat to produce blisters on purpose, then an enema. And finally, more bloodletting. Our founding father lost more than 80 ounces of blood that night. The early cures for mental illness, on the other hand, are no less gruesome, like ice pick lobotomies. That's one of the topics of my next guest's new book, Shrinks, The Untold Story of Psychiatry. Dr. Jeffrey Lieberman. Lieberman is chairman of psychiatry at Columbia University College of Physicians and Surgeons here in New York. And we have an excerpt of the book up at our website, sciencefriday.com/shrinks. Welcome back to the program.
Thank you very much. It's great to be here with you, Ira.
Thank you. Nice to have you. You write in the book, quote, "The profession for which I have dedicated my life remains the most distrusted, feared, and denigrated of all medical specialties."
Well, to put it in a little more cavalier way, I think of psychiatry as the Rodney Dangerfield of medical specialties. We don't get the respect we deserve. You were talking about the description of George Washington's treatment, which is probably as much responsible for his death as the illness for which he was being treated. And we've long forgotten and forgiven the past mistakes of internal medicine, surgery, and so forth, but we haven't in terms of the treatment of mental illness, and that was a big motivation to write the book.
So why haven't we we forgive the old doctors, why can't we forgive the psychiatrists, mental illness?
I think because it took psychiatrists and medical science longer to really come to terms with what the cause of mental illness was, how to define it, and to develop effective treatments. So it really was the late bloomer of medical specialties, and it only recently was able to make a credible case to regain the trust of the public. It really began after World War II in the 1950s. So when you think about it, it's only been in the last half century that psychiatrists had a scientific foundation and could offer anything that was remotely capable of producing therapeutic effects.
But before then, we used to hear, what happened to Freud? I mean, you mention in your book about how Freud has, you quote Edward Shorter, who says, Freud's ideas, which dominated the history of psychiatry for much of the past century, are now vanishing like the last snows of winter.
Right. Well,
people used to quote him all the time.
And still do.
Woody Allen movies is full of it, you know?
And still do. I mean,
Yeah.
we have Freudian slips, we have defense mechanisms, we have all kinds of references in our vernacular. Freud was brilliant and is the most famous and important psychiatrist in history, but he's also, as I put it, most calamitous rogue in the book. And the reason is because Freud came on the scene. He was actually a neurologist, not a psychiatrist, but the brain doctors had overlapping areas of interest in the 19th century. And he came on the scene when there was an intellectual vacuum. There was no understanding, scientifically speaking, whatsoever what caused mental illness. We had some idea of heart disease, we had some idea of cancer, we had some idea of infectious disease with Pasteur. We had no idea with mental illnesses. Freud invented this brilliant theory which filled the vacuum. The problem was that it was a theory that pertained to how the human mind developed and functioned in normal instances, or for what I call the worried well. It had little to no relevance to what we know as mental illness, but it was extended to all manner of mental illness by Freud's protégés, his successors, the neo-Freudians, and that begat explanations for schizophrenia by what's called the schizophrenogenic mother, the mother who was contradictory and gave double messages. It produced the cause of autism, being the refrigerator mother, the cold, remote, uncaring mother who didn't bond with her infant. And the worst sin of all was it allowed psychiatry to be utilized by society as an instrument of its moral prejudices, and it determined homosexuality as a mental disorder, ostensibly caused, according to psychoanalytic theory via the neo-Freudians, as the result of a castrating, domineering mother and a weak, effete father. So Freud was really a brilliant person who made a breakthrough, but it was extended way beyond its relevance, and psychiatry had nothing to counter it until really the scientific revolution in the 1950s.
And you mentioned that along came Eric Kandel and helped put, who really liked Freud, right? And then had to change his whole view, actually helped take down Freud.
Well, in the history of psychiatry, just like in all fields, there's heroes and villains.
Mm-hmm.
Freud was a hero, really, but he suffered an unkind fate because of, in the same way some people might say Christ suffered an unkind fate in the way that Christianity has produced sort of warring factions. But Kandel was really a maverick who was a visionary. He was, like Freud, born in Vienna. He and his family had to flee Europe because of the Nazis, because he was Jewish. He landed in New York, went to college at Harvard intending to understand what could cause his countrymen, who had been his friends, to turn on him. And he met someone there who said, well, if you understand human nature, you have to become a psychiatrist. So he decided to go to medical school. But while he was becoming an analyst, which was really the path towards psychiatric success in academic medicine, he thought, if I'm going to study the mind and mental illness, I think I should need to know something about the brain. So he decided in the summers to spend time in the laboratory of a brain scientist, and that led him really off into the scientific wilderness because neuroscience had not yet been defined, and he basically forged the path to which psychiatry is now hewing, which is a path of understanding how the brain underpins behavior in mental illness.
Discovered the methods of memory storage.
Exactly. He won the Nobel Prize in 2000 for discovering the molecular and cellular basis of memory.
He's an old friend of this program, so we've had him on many times. He's talked about it. Let's talk about some of these cures. You write about that electroconvulsive therapy, which started out in those early days and got sort of a bad name in the popular imagination in films like One Flew Over the Cuckoo's Nest and things like that. It's still used today.
Very much so.
With much evidence to support it.
I have patients in the hospital this very day who receive treatment, and it's for them life-saving. It's ironic, Ira. There's been 3 Nobel Prizes in history for psychiatry. Mm-hmm. Kandel received the 3rd. The first, though, was given for something called malaria therapy, where they infected insane patients with the blood of victims of malaria.
And it worked?
It only worked for people who didn't have schizophrenia but who had tertiary syphilis. But at the time, there was nothing else for anybody. The second was for the Portuguese neurologist Moniz, who developed the prefrontal lobotomy technique that was infamously adapted by Walter Freeman with ice picks. In between then, 2 Italians developed electroconvulsive therapy, and that didn't get the Nobel Prize, but it was the one treatment that really worked and is still used today. And despite its notorious reputation, it's totally undeserved, and for people who medications are ineffective for or are so dire, so severely ill that they are either actively suicidal or not eating and drinking and close to having severe medical complications, ECT is a lifesaver. And there's people who who are public figures, anonymous, of course, in terms of their psychiatric histories, who are functioning, and if it weren't for their ability to continue to get ECT, wouldn't be in the positions they're in.
People in politics today.
Politics, people in entertainment, people in the news industry. It's not the Thomas Eagleton situation anymore. Right. But at the same time, these people aren't coming out publicly and talking about it.
So tell us about the ice pick. I mean, that just seems, wow.
Well, it's easy to think that the people that did this were venal, barbaric, cruel, but we have to resist the temptation to view it through presenteeism, looking at the past through the future's lens or the present's lens. At the time, the only hope that medicine could offer people who had severe forms of mental illness, schizophrenia, bipolar disorder, psychotic depression, autism, was institutionalization. There was no treatments to alleviate their symptoms unless they spontaneously remitted. And so psychiatrists were desperate. And Moniz, who was actually not a psychiatrist, a neurologist, developed this technique because the idea of understanding the brain, neural circuits, the brain underlying the mind mediating behavior, was gaining resonance. And so he determined, because people who were insane seemed to be so frenetic and so overactivated, that perhaps if we excise some of the circuits in the brain, this would calm them down. And that was the basis of it. But when Walter Freeman, who was an American neurologist, said, look, the way Moniz developed it, it could only be performed in the operating room. You needed to have a neurosurgeon to drill burr holes in the skull and then introduce the scalpel to sever certain circuits in the frontal lobe. I want to make it practical so that a doctor could do it in his office. And he adapted the method to go through the eye socket with an ice pick. And tragically, by the time he was finished, about 3,000 people in the United States had had prefrontal lobotomies, including President John F. Kennedy's sister, Rosemary.
Yeah, I remember that story. Talking with Jeffrey Lieberman, author of Shrinks, The Untold Story of Psychiatry. Let's go to the phones to Jason in Yorktown, Virginia. Hi, Jason.
Yeah, hi. Good afternoon, Ira and Dr. Friedman. Thank you for letting me talk on the show. I've been a long-time listener, but it's my first time calling in.
Long time, first time. Yes, go ahead.
So I just had a question about the scope of the DSM. It's very broad, and we all understand that there can be a stigma associated with the mental health diagnoses. Also understanding that some are, more serious than others. But I was just curious if the doctor could maybe give his opinion on whether a majority of Americans would probably fit into one of the many diagnoses in the DSM, or whether if you were to assess everybody in the country, you probably would have about the same numbers that we have now.
All right, thanks for that question.
Well, the answer is no. Everybody would not fit into a diagnosis. There's 265 diagnostic categories. If you do the math with the epidemiology, it turns out that it may be 1 in 4 individuals within their lifetime will experience one of these conditions. And they happen at different ages of life. So some might encounter them as children or adolescents, others as adults, others in middle age, and others in senescence. But it's about 1 in 4. It's still quite a large number. But I think what you're getting at is there a tendency for psychiatry to kind of proliferate these diagnoses, try and pathologize normal behavior, and drum up business for themselves and the pharmaceutical companies? That's the rap that the anti-psychiatry critics level at us, and the answer to that is flatly no. There's no, all of the diagnoses have a credible scientific basis for them. Many of them seem to be unusual. They seem to be, in some cases, even frivolous, but they are vetted, they are studied before they can ever get formal designation as an illness. And there have been some very controversial ones. For example, one of the new conditions that was added to the DSM-5, the most recent revision, is called hoarding disorder. It's about people who can't throw things away, they keep them. Now, you say, well, that's ridiculous. My husband, my wife, my sister, my brother, they're pack rats. They don't throw things. People with hoarding disorder, it's so extreme that their apartments, their houses are filled ceiling to floor, wall to wall. They don't throw anything away. There are health hazards with vermin. They haven't been out of the house because they're tending this for months and years, and they have to be rested by their family members or the police.
They even have reality shows on TV now about it. Let me just remind everybody, in case you joined us, talking with Jeffrey Lieberman, author of Shrinks, The Untold Story of Psychiatry, on Science Friday from PRI, Public Radio International. We've got a couple of minutes before the break. Let's talk about a couple of other things. When did talk therapy make a comeback, or did we lose it?
Oh, we've never lost it.
I mean, was that beginning with Freud and then kept going?
Yeah, Freud developed this theory, which was the first real theory of, the mind and, by extension, mental illness. And after his theory, he needed to find a way to make it therapeutically useful. So he developed what was called the talking cure. And the talking cure later became defined as psychoanalytic therapy. lying on the couch, free associating, telling your dreams, and so forth. That was a very innovative thing at the time. It's a very, in some instances, effective approach, if for nothing else, in giving a person insight into their own personality and how they behave. The problem is that Freud was a control freak and wouldn't allow it to be subject to scientific verification, so it was never verified. But the renaissance of talk therapy came really in the 1960s and 70s, when psychiatry required scientific verification of every treatment, whether it was ECT, psychotropic drugs, or talk therapy. And people like Aaron Beck developed what was called cognitive behavioral therapy. Myrna Weissman developed interpersonal therapy, dialectical behavioral therapy. So there has been a renaissance in developing these evidence-based therapies.
But we hear so much that psychiatry has now just become, give it a drug. We'll give you a drug. We'll give you more drugs until we find the right drug that works for you, whether it's for ADD or for bipolar or something like that. And talk therapy is sort of adjunct to the drug side.
Well, it depends on the illness and what the necessary treatments are. So I think there's a couple of things which pertain to that. First, to the comment that we over-medicate our society and we're giving people a pill instead of trying to find out the real problem. The reality is there is some degree of probably excessive or inappropriate prescribing, particularly in the area of stimulants for ADHD, antidepressants, anxiolytic. But you want to know something, Ira? We prescribe painkillers too much. We prescribe antibiotics too much. We use orthopedic arthroscopic surgery for degenerative arthritis when it's ineffective too much. And the fundamental reality is, even though this is no way an excuse for promiscuous prescribing, there are vastly more people who have severe mental illnesses who don't get treatment with medication than there are people who have illnesses or have symptoms which don't warrant treatment.
All right, we'll get back, talk lots more about this. Talking with Jeffrey Lieberman, author of Shrinks, The Untold Story of Psychiatry. Quite an interesting book. If you'd like to talk about psychiatry, our number 844-724-8255, or just tweet us at SciFry. We'll get your message either way. We'll be back after the break. I'm Ira Flato in New York. Stay with us. In case you just joined us, you're listening to Science Friday from PRI. I'm Ira Flato, talking with Jeffrey Lieberman, author of Shrinks, The Untold Story of Psychiatry. And when I rudely interrupted him to go to the break, we were talking about whether there's overprescribing of drugs in psychiatry. And you were making a valid point that there's overprescribing of drugs in all fields of medicine.
That's right. But because psychiatry is really the scapegoat in so many ways in medicine, psychotropic drug overprescription gets criticized. But it does exist to some. But the bigger problem, as I mentioned, Ira, is the fact that so many people who do definitively need and could benefit don't get it because of stigma and lack of access. But there's another factor that really plays into this, and that's in the modern age we have this time pressure. Healthcare costs are burgeoning. The government is trying to ratchet them down with cost containment and healthcare reform strategies. Doctors are pressed for time. So it's harder to talk to the patient, to try and really go into what's happening in their life to find out how this may be contributing to their psychiatric or emotional difficulties. And it's easier to sort of more expedient to write a prescription. The other thing is that many people don't get to a psychiatrist. It's their primary care doctor who they're seeing. And the primary care, in fact, the majority of prescriptions that are written for antidepressants, anxiolytics, hypnotics, sleep medications are written by non-psychiatric physicians. And although they're trying to solve the problem, they often don't use the right medication or the right dose, and this contributes to what is perceived as medicating problems ineffectively.
As more states adopt the legalization of marijuana, are we going to see a change? You're shaking your head. You're shaking his head like crazy. I didn't have to finish the question. What's the answer?
I mean, we're running a great social experiment here that nobody knows the outcome of. It's interesting. On Wednesday, Nora Volkow, the director of the National Institute of Drug Abuse, was up here, and for a meeting. And Nora had called me several years ago when this expansion of medical marijuana was being used, let alone legalizing it, such as Colorado has done. And the thing is that you can understand the justification from the sense that, well, tobacco, alcohol, recreational intoxicants that are legal that we use are harmful in some ways, but we don't outlaw them. Marijuana is no more harmful than these. Why shouldn't we? The problem is we don't know what the consequences are to the full extent. And what we have an idea about is that although they may be readily usable and reasonably safe for adults, in kids, it's not the case. We already know that the use of marijuana increases the frequency of certain mental disorders, particularly psychoses. And we're now learning that the use of marijuana, particularly heavy use with potent forms, affects adolescent brain development. Now, you can say, well, the age to buy it is 21. They're not going to get it, but we know it doesn't work with alcohol. It doesn't work with cigarettes. They're going to get it.
Yeah.
So I think we're all holding our breath.
So you say we're just doing a giant experiment.
Exactly. This is a huge social experiment, and I'm sure that there will be an impact on the frequency of specific mental disorders, particularly in youth, as a result of it.
We have about a minute left. Can you summarize for us where you see psychiatry going, headed? What's the trend at all? Is there a trend in the future?
There absolutely. I mean, psychiatry was the runt of the litter, the late bloomer, but it is now entering what I really believe is a golden age, and that's because previously the brain was so complicated, and the areas of the brain that mediated behavior, mental function, and mental illness were the most evolved and sophisticated forms of the brain. We couldn't get any understanding on them, but because of the scientific revolution, genetics, imaging, pharmacology, molecular biology, now the President's Human Brain Initiative to develop neurotechnology, psychiatry is going to be catapulted forward. And there will be a renaissance in how it's diagnosed and how it's treated. The big problem and the major motivation for my book was that the old attitudes and stigma still prevail. And as you know, psychiatry has the dubious distinction of being the only medical specialty with an anti-movement.
And that's a good place to end. It's a wonderful book, Dr. Lieberman. It is terrific. Jeffrey A. Lieberman, author of Shrinks, The Untold Story of Psychiatry. You would think that it'd be hard to read. This is a really easy read and very informative. Thank you for taking time to be with us.
It's my pleasure. Thank you, Ira.
You're welcome.